Professor. Hello, my fellow pharmacy students. My name is Badmus Aisha, and I'm here to present my seminar presentation on the topic discuss the theoretical considerations and principles that underlie successful pharmacotherapy. Abstract. Pharmacotherapy is the process of treating diseases and improving health through the use of pharmacological agents. Successful pharmacotherapy relies on a comprehensive understanding on several key principles, including pharmacodynamics, pharmacokinetics, patient-centered care, and the ability to address specific clinical needs. This paper discusses the theoretical considerations and principles that underlie successful pharmacotherapy, focusing on factors such as the mechanism of action of drugs, drug interactions, patient compliance, and the impact of pharmacogenetics. It also examines the importance of monitoring drug efficacy and safety, as well as the role of pharmacists in optimizing therapeutic outcome. By understanding and applying these principles, healthcare providers can ensure that pharmacotherapy is both effective and safe, leading to better health outcomes for patients. Introduction. Pharmacotherapy is a cornerstone of modern medical practices and a critical component of disease management. Defined broadly, pharmacotherapy refers to the treatment of diseases through the administration of drugs. Its successes hinge on a comprehensive understanding of the biological, chemical, physiological, and pathophysiological processes involved in disease and healing. Over the past centuries, the field has evolved significantly, with advances in biomedical research leading to the discovery of novel drugs and therapeutic agents designed to target specific molecular pathways. Consequently, the art and science of pharmacotherapy demands an integration of theoretical knowledge with clinical skills to optimize patient outcome. The practice of pharmacotherapy is underpinned by several theoretical considerations that guide healthcare professionals in selecting, prescribing, and monitoring drug treatment. These considerations include, but are not limited to, pharmacokinetics, that's how the body affects the drug, and pharmacodynamics, how the drug affects the body. The therapeutic index and patient-specific factors such as age, weight, genetic profile, comorbidities, and even socioeconomic status. And without a thorough grasp of these fundamental principles, drug therapy may be ineffective or even harmful. Moreover, successful pharmacotherapy is not merely about choosing the right drug. It encompasses a holistic approach that involves patient education, monitoring for adverse drug reactions, adjusting therapy based on therapeutic response, and ensuring adherence to treatment regimens. Effective pharmacotherapy requires a continuous dynamic process of assessing and reassessing therapeutic outcome in response to changing patient needs. This dynamic nature makes it essential to ground therapeutic decisions in a robust theoretical framework that can accommodate both the complexities of disease and the individuality of patients. In addition to scientific and clinical knowledge, ethical and economic considerations increasingly influence pharmacotherapy. Healthcare providers must navigate challenges such as drug costs, access disparities, regulatory guidelines, and the influence of pharmaceutical marketing. These external factors can significantly impact the availability and appropriateness of certain therapies, particularly in resource-limited settings. Therefore, understanding the broader context within which pharmacotherapy operates is essential for ensuring equitable and effectiveness healthcare delivery. So, this presentation aims to extensively discuss the theoretical considerations and the principles that underlie successful pharmacotherapy. It will examine key concepts such as pharmacokinetics, pharmacodynamics, therapeutic drug monitoring, clinical decision-making, and patient-centered care. Furthermore, it will explore the critical role of pharmacists and other healthcare professionals in ensuring that drug therapy is safe, effective, and tailored to the need of each individual patient. By the end of this discussion, a deeper appreciation of the intricate balance between drug science and patient care pharmacotherapy will be achieved. The theoretical foundation of pharmacotherapy. Pharmacotherapy is fundamentally rooted in several core scientific theories that provides a basis for understanding how drugs exert their effect within the body and how they can be used effectively to treat diseases. Mastery of this theoretical foundation is crucial for ensuring that pharmacotherapy is both rational and effective. The following concept represents the backbone of pharmacotherapeutic practice. We have the pharmacokinetics, how the body affects the drugs. Pharmacokinetics refers to the movement of drug through the body and describes the processes of absorption, distribution, metabolism, and excretion. Understanding these processes is critical for designing appropriate drug dosing regimens and achieving desired therapeutic outcome, which is the absorption, distribution, metabolism, and excretion. Absorption refers to the process by which a drug enters the bloodstream from its site of administration. Factors such as drug formulation, route of administration, and gastrointestinal pH can significantly influence absorption rate and extent. Distribution. Once absorbed, drugs are distributed to tissues throughout the body. Distribution depends on the factors such as blood flow, tissue permeability, and binding to plasma proteins. Metabolism. Primarily occurring in the liver. Metabolism transforms drug into more water-soluble compounds. For easier excretion, the cytochrome 450 enzyme system play a central role in drug metabolism. Excretion. Drug and their metabolites are eliminated from the body primarily through renal excretion, which is the urine, but also via bile, sweat, saliva, and breast milk. The pharmacokinetic profile of a drug informs clinicians about how frequently and at what dosage a drug should be administered to maintain therapeutic levels without causing toxicity. Pharmacodynamics, how drug affects the body. Pharmacodynamics focuses on the biological and physiological effects of the drug on the body, including the mechanism of action at the molecular and cellular levels. Key pharmacodynamic concepts include drug receptor interaction. Many drugs act by binding to the specific receptor on the surface or within target cells. This binding can either activate the receptor, a agonist effect, or block it, which is the antagonist effect. Dose response relationship. This describes how the magnitude of the drug effect varies with its concentration or dose. It helps identify the minimum effective dose and the maximum effective dose. Therapeutic window. The range of drug concentration in the blood and the range of drug concentration in the blood that elicits the desired effect without causing significant side effects. Understanding pharmacodynamics is essential for predicting the effect of drug, optimizing therapy, and avoiding adverse effects. Receptor theory. Receptor theory provides the framework for understanding drug action at the cellular level. The theory posits that drug efficacy and potency are determined by the drug's affinity, binding strength for a receptor and its intrinsic activity, ability to activate the receptor. Different types of receptor interactions include full agonist, partial agonist, antagonist, and inverse agonist. This interaction explains how drugs can vary widely in their effects, despite targeting the same receptor base. The therapeutic index. The therapeutic index is a measure of drug safety margin It is the ratio of the toxic dose to the effective dose at high therapeutic index indicates a wide safety margin, while a low therapeutic index suggests that the drug must be used with caution and careful monitoring. Drugs such as warfarin and digoxin have narrow therapeutic indices, which meaning small variations in drug levels can lead to toxicity or therapeutic failure, necessitating regular monitoring. Pharmacogenomics. Pharmacogenomics examines how genetic variation affect drug response. Variation in genes encoding drug metabolism enzymes, drug transporters, or drug targets can profoundly impact the efficacy and safety of pharmacotherapy. For example, genetic polymorphism in the CYP19 gene can affect the metabolism of clopidogrel, a platelet inhibitor used in patients with cardiovascular diseases. Understanding pharmacogenomics allows the personalized drug therapy, maximizing benefits and mimicking risk. We also have individual variability in drug response. Individual patient factors including age, body weight, gender, renal or hepatic function, and comorbidities can influence both pharmacokinetics and pharmacodynamics. As such, successful pharmacotherapy demands an individualized approach to drug selection and dosing. Summary of section 2. In summary, the theoretical underpinning of pharmacotherapy, pharmacokinetics, pharmacodynamics, receptor theory, therapeutic index, and pharmacogenomics, and patient variability form a comprehensive framework that guides the safe and effective use of medication. A deep understanding of this principle is essential for healthcare providers who aim to achieve optimal therapeutic outcomes. My third section, which is the principles of successful pharmacotherapy. Successful pharmacotherapy involves the application of theoretical knowledge into practice to ensure optimal patient outcome. This requires not only a strong foundation in pharmacological science, but also a careful consideration of individual patient needs, evidence-based practice, clinical decision-making, and continuous monitoring. The principles outlined in this section offer a comprehensive framework for healthcare professionals to achieve therapeutic success, which we have individualized therapy, that's patient-centered therapy. No two patients are exactly alike, and the success of pharmacotherapy often hinges on individualizing treatment plans. Patient-centered care involves tailoring drug therapy to suit a patient's specific characteristics, preference, comorbidities, lifestyle, and genetic factors. It also considers cultural and physiological factors that may influence adherence and therapeutic response. For example, a hypertensive patient with chronic kidney disease may require different antihypertensive agents than a hypertensive patient with asthma. A hypertensive patient with chronic kidney disease may require different antihypertensive agents than a hypertensive patient with asthma. Pharmacotherapy must be responsive to these differences, promoting individualized care to minimize harm and maximize benefits. Also have rational drug selection. Rational prescribing is the process of selecting the most appropriate drug based on clinical evidence, patient-specific factors, drug efficacy, safety profile, cost effectiveness, and accessibility. The World Health Organization outlines key steps in rational drug use, defining the patient's problem, specifying the therapeutic objective, choosing the standard treatment, and checking for suitability. This principle ensures that drugs are not prescribed unnecessarily or incorrectly. It also helps prevent polypharmacy, a common cause of drug-to-drug interactions and adverse effects, especially in elderly patients. Dose optimization and therapeutic regimens. A successful therapeutic outcome depends not just on the right drug but also on the correct dose, dosing intervals, and the duration of therapy. Dose optimization is critical to maintain the drug plasma levels within the therapeutic window, avoiding subtherapeutic effects or toxicity. Factors influencing dosing including age, body weight, renal and hepatic functions, pharmacokinetics of the drug, and the severity of the disease. Pediatric and geriatric patients often require special consideration due to altered physiological and drug metabolism. We also have adherence to therapy. Non-adherence to prescribed medications is a significant barrier to successful pharmacotherapy. Patients may fail to take drugs due to forgetfulness, misunderstanding instruction, side effects, financial constraints, or lack of perceived benefit. Promoting adherence includes patient education on disease and drug response, purpose, simplifying dosing schedules, using fixed dose combinations, regular follow-up and counseling. Pharmacists play a vital role in improving adherence through medication therapy management programs. We also have monitoring and follow-ups. Effective pharmacotherapy requires regular monitoring to assess drug efficacy and detect adverse effects early. Monitoring may include clinical evaluations like blood pressure, symptoms resolution, laboratory tests like liver function and serum drug levels, and patient-reported outcomes. Follow-ups allow for timely adjustment to therapy. For example, a diabetic patient on insulin requires ongoing blood glucose monitoring to prevent hypoglycemia and ensure glycemic control. We also have adverse drug reaction and safety surveillance. Recognizing and managing ADR is essential in pharmacotherapy. ADR may be dose-related, allergic, idiosyncratic, or due to drug interactions. Pharmacovigilance systems help detect and report these reactions for regulatory actions and improving drug safety. The principle of first do no harm is foundational, and healthcare providers must always weigh the benefits against the risk when prescribing medications. We also have therapeutic drug monitoring. Therapeutic drug monitoring is the practice of measuring drug concentration in blood at designed intervals to maintain therapeutic levels and avoid toxicity. It is particularly important for drugs with narrow therapeutic indices. Therapeutic drug monitoring. Therapeutic drug monitoring is the practice of measuring drug concentration in blood at designated intervals to maintain therapeutic levels and avoid toxicity. It is particularly important for drugs with narrow therapeutic indices such as digoxin, phenytoin, and lithium. Therapeutic drug monitoring also considers the patient's response and helps in fine-tuning dosage in special populations like patients with renal impairment or transplant recipients. We also have drug interactions and polypharmacy management. In patients taking multiple medications, drug interaction may reduce efficacy or increase the risk of toxicity. Pharmacists and prescribers must routinely assess for potential interactions, including those involving food, herbal products, and over-the-counter drugs. Managing polypharmacy is crucial, especially among the elderly or those with chronic illnesses. Describing a systematic withdrawal of necessary medications can improve patient outcomes and reduce adverse effects. Evidence-based practice. The principle of evidence-based pharmacotherapy involves integrating the best available clinical research with clinical expertise and patient values. Clinical practices guidelines and systematic reviews provide a framework for drug selection and treatment decisions. Healthcare providers must remain updated with current literature, as pharmacotherapy is a dynamic field with continuous emergence of new drugs, indications and contraindications. We also have shared decision making and ethical considerations. Successful pharmacotherapy involves shared decision making, where patients are actively involved in their treatment choices. This enhances trust, compliance, and satisfaction. Ethical considerations include respecting patients' autonomy, informed consent, confidentiality, and ensuring equitable access to medications. These principles foster a therapeutic alliance and improve outcomes. Summary of Section 3. The success of pharmacotherapy lies not only in understanding drug action, but also in applying key principles such as patient-centered care, rational prescribing, dose optimization, monitoring, and adherence support. When healthcare providers adopt these principles holistically, they enhance drug efficacy, minimize risk, and improve patient quality of life. Now, Section 4. The role of pharmacists in pharmacotherapy. Pharmacists play an indispensable role in ensuring the safety, efficacy, and cost-effectiveness of pharmacotherapy. The unique training in pharmacological sciences and therapeutic positions them at the front line of medication management, patient counseling, drug monitoring, and interprofessional collaboration. In modern healthcare system, pharmacists are shifting from being merely dispensers of medicine to becoming active participants in clinical decisions and patient-centered care. And under the role of pharmacists, we have the first one to be medication therapy management. Medication therapy management is a service or group of services provided by pharmacists aimed at optimizing therapeutic outcomes for patients. We shall have one as American Pharmacists Association. The medication therapy management include reviewing medication regimens, identifying potential drug interaction, preventing adverse drug reaction, and improving adherence. Pharmacists assess whether a medication is necessary, effective, safe, and convenient for the patient. By ensuring the appropriate drug use, they help reduce medication errors, lower healthcare costs, and improve patient outcomes. Secondly, patient counseling and health education. One of the most visible roles of pharmacists in pharmacotherapy is patient education. Pharmacists are often the last point of contact before a patient begins taking a medication, making them vital in ensuring proper understanding of drug use. Effective patient counseling includes explaining the purpose of the drug, detailing the correct method and time for administration, discussing potential side effects and interactions, advising on storage condition and missed doses, addressing patient concerns and questions. Health literacy significantly affects medication adherence. Pharmacists bridge the gap between complex drug regimens and patient comprehension. A third point, ensuring drug, patient, and pharmacovigilance. Pharmacists are central to pharmacovigilance system structures for monitoring and reporting adverse drug reactions. They identify and document drug-related problems, assess causality, and report findings to regulatory bodies such as the National Pharmacovigilance Center or WHO Monitoring Center, WHO Uppsala Monitoring Center. By actively participating in adverse drug reaction monitoring, pharmacists contribute to early detection of drug-related hazards, recall of unsafe medication, and post-marketing surveillance. Fourth one, promoting rational use of medication. Pharmacists champion rational drug use by advocating for appropriate prescribing, dispensing, and administration practices. In collaboration with physicians and other healthcare professionals, they help ensure that patients receive medication that are clinically appropriate, in the correct dose and duration, and at the lowest cost to both the patient and the community. They also develop and implement formulate system and treatment guidelines within hospitals and communities. We also have clinical decisions, support, and interprofessional collaboration. In hospitals and primary care settings, clinical pharmacists are increasingly involved in ward rounds, where they provide inputs on drug selection, dose adjustments, and potential interactions. Their presence on healthcare team has been shown to reduce medication errors and improve treatment outcomes. This collaboration fosters a multidisciplinary approach to patient care and ensures that pharmacotherapy decisions are evidence-based and patient-centered. We also have antimicrobial stewardship. Pharmacists play a vital role in antimicrobial stewardship programs designed to combat antibiotic resistance. They help review antimicrobial prescription for appropriateness, monitor microbial sensitivity trends, educate prescribers and patients on judicious antibiotic use. Their involvement has been linked with reduction in unnecessary antibiotic use and better infection control outcomes. Also have addressing medication adherence challenges. Pharmacists design interventions to improve patient adherence through various strategies: pill organizer and reminder system, fixed dose combination, refill and synchronization programs, follow-ups, call and text alerts. You need to do that. You need to start doing it. They also conduct adherence assessments and motivational interviews to understand patient-specific barriers and offer tailored solutions. We also have community and public health engagement. Beyond clinical roles, pharmacists are involved in promoting public health initiatives such as immunization campaigns, smoking cessation programs, chronic disease screening, and lifestyle counseling. In rural or undeserved areas, pharmacists may serve a primary healthcare providers, making their involvement critical to improving access to safe, effective pharmacotherapy. Summary of section 4. Pharmacists play a pivotal and multifaceted role in pharmacotherapy process, from drug selection and counseling to monitoring and public health advocacy. As gatekeepers of medication safety and champions of patient-centered care, pharmacists are instrumental in translating pharmacotherapeutic theory into successful clinical practices. Factors influencing the success of pharmacotherapy. Pharmacotherapy outcomes are influenced by a complex interplay of biological, physiological, social, and systemic factors. Understanding these variables is essential for healthcare providers to anticipate challenges and tailor therapeutic interventions appropriately. This section highlights the major factors that impact the effectiveness, safety, and adherence to drug therapy. Then my section 5 is patient-specific factors. And one of the factors, number 1, we have age. Age is a critical determinant in pharmacotherapy. In neonates and infants, immature liver and kidney function can significantly affect drug metabolism and excretion, increasing the risk of toxicity. Conversely, elderly patients often experience age-related physiological changes, such as reduced renal clearance and altered drug sensitivity, necessitating drug dosage adjustments. Also, our gender and hormonal differences. Gender can influence drug responses due to variation in hormone levels, body fat distribution, and enzyme activity. For example, women are more susceptible to QT intervals, prolongation with certain medications, which increases the risk of toxins. Toxic the points. Sounds French. Understanding these differences can help optimize dosage, reduce adverse effects. We also have genetics and pharmacogenomics. Genetic variability in drug metabolizing enzymes, that's cytochrome-450 isoenzymes. Drug targets and transport proteins can lead to inter-individual differences in drug response. For instance, individual with CPY2450, CPY2D6, poor metabolizer phenotype may experience reduced efficacy or increased toxicity of certain antidepressants and beta blockers. Pharmacogenomics is therefore a growing field that supports personalized medicine by matching drug to a patient's genetic profile. We also have nutritional status and diet. Malnutrition can impair protein binding and liver enzyme function, altering drug pharmacokinetics. Additionally, food-drug interaction can either enhance or inhibit drug absorption. For instance, grapefruit juice inhibits CYP3A4, potentially increasing serum level of calcium channel blockers and statins. Okay. We also have physiological and behavioral factors. Mental health, cognitive function, and the attitude towards illness and medications can impact adherence. Depression, anxiety, or substances abuse may reduce a patient's ability to comply with therapeutic regimens, thereby compromising outcomes. We also have disease-related factors. That's another patient-specific factor. So the disease-related factors, we have it has like a stage and severity of the disease. The effectiveness of pharmacotherapy can vary depending on the progression and severity of the condition. Early stage disease may respond well to standard therapy, while advanced stage often require combination regimens or higher dosages, which may increase the risk of adverse effects. We also have comorbidities. Multiple coexisting disease can complicate pharmacotherapy due to overlapping symptoms and the need for multiple medications. This increases the risk of drug-to-drug interactions and polypharmacy. For example, managing hypertension in a diabetic patient requires careful selection of antihypertensives that can also offer renal protection. We have drug-related factors, which is the third factor. And under it, we have drug formulation and bioavailability. The physical and chemical properties of a drug formulation, including solubility, stability, and routes of administration, affect its absorption and bioavailability. Poorly soluble drugs may require special delivery systems, such as lipid-based carriers or nanoparticles for optimal therapeutic effects. We also have dosage and dosing regimen. Inadequate dosing, whether subtherapeutic or supratherapeutic, can lead to treatment failure or toxicity. Time-dependent drugs like beta-lactam antibiotics require frequent dosing to maintain therapeutic levels, while concentration-dependent drugs like aminoglycosides benefit from once daily high doses. We also have drug interaction. Pharmacokinetics and pharmacodynamics interactions can enhance or reduce drug efficacy or increase the risk of adverse reactions. For example, combining warfarin and non-steroidal anti-inflammatory drugs elevates the risk of bleeding due to synergistic effects on platelet function and gastrointestinal mucosa. We also have healthcare system and provider factors, and under it we have the prescriber's knowledge and experience. The competence of the healthcare provider in diagnosing, selecting appropriate therapy, and monitoring the response is vital. Errors in prescription due to lack of knowledge or negligence can compromise patient safety and therapeutic outcome. Access to medication. In many low and middle income countries, access to essential medication remains a challenge due to cost, availability, and logistic constraints. Interrupted therapy and use of standard or counterfeit drugs are common. Use of substandard or counterfeit drugs are common, undermining pharmacotherapeutic success. Health literacy and communication. Clear communication between healthcare providers and patients enhances understanding and adherence. Poor health literacy has been linked with medication errors, non-compliance, and increased hospitalization rates. We also have follow-ups and community care. Ongoing patient monitoring and follow-up are necessary to evaluate the therapeutic process, adjust doses, and detect adverse reaction. Inconsistent follow-up may lead to poor disease control, and inconsistent follow-up may lead to poor disease control and complications. And summary of section 5. Pharmacotherapy is influenced by a multitude of factors ranging from patient-specific variables like age and genetics to systemic issues like drug availability and healthcare infrastructures. Understanding these determinants enables healthcare professionals to determine and implement effective treatment plans, ensuring therapeutic success. We have 6th section to be challenges and barriers to effective pharmacotherapy. While pharmacotherapy has revolutionized the management of disease and improved life expectancy globally, various challenges persist that compromise its optimal implementation. These barriers exist at multiple levels: individuals, institutional, and societal, and affect the effectiveness, safety, and accessibility of drug therapy. Understanding these challenges is essential for designing interventions that ensure equitable, evidence-based care. And under the challenges and barrier, we have patient-related barrier. And under patient-related barrier, we have to be poor adherence and medication regimens. Non-adherence is one of the most common challenges in pharmacotherapy. Factors contributing to poor adherence include forgetfulness, fear of side effects, complex drug regimens, and lack of perceived benefits. In chronic diseases like hypertension and diabetes, patients may discontinue medication when symptoms are not obvious, leading to poor disease control. We also have cultural and religious beliefs. In some communities, traditional or religious beliefs may influence perceptions about disease causation and treatment. This can lead to reliance on herbal remedies or spiritual healing instead of prescribed medication. Patients may also believe in fatalism or divine predestination, affecting their willingness to adhere to treatment. We also have health literacy and education. Then we have drug-related barriers, and under drug-related barriers, we have adverse drug reaction, fear or experience of side effects may cause patients to stop taking their medication or avoid certain classes of drug altogether. Adverse drug reactions are also a major reason for emergency department visits and hospital admissions, especially in the early and those on multiple medications. We also have polypharmacy to be a factor. Polypharmacy and drug interaction. Polypharmacy, especially in geriatric patients and those with multiple chronic conditions, increases the risk of drug-to-drug interaction, therapeutic duplication, and confusion regarding dosing schedule. Managing these complexities can be bothersome for both healthcare providers and patients. We have healthcare system barriers, which is cost and affordability of medicine, inadequate supply chain and drug stock out, limited access to trained professionals. Then next we have regulatory and policy related challenges, and under it we have standardized and falsified medicine. The circulation of fake or substandard medicines poses a severe threat to public health. These products may contain incorrect dosages, harmful contaminants, or no active ingredients at all, leading to treatment failure and loss of trust in healthcare system. Under it, we also have inadequate pharmacovigilance system. Weak drug surveillance system reduce the ability to detect and respond to safety concerns, underputting adverse drug reaction and lack of real-time monitoring, compromise patient safety and reduce opportunity for learning from medication-related events. Poor implementation and guidelines. Even when comprehensive treatment guidelines are available, they may not be followed consistently due to inadequate dissemination, poor training, or resistance to change among healthcare providers. This leads to irrational prescribing and suboptimal therapeutic outcome. In summary, for section 6, effective pharmacotherapy is not only based on sound clinical principles but also require addressing practical barriers that limit its impact. These challenges range from patient behavior to drug quality to systemic inefficiency and policy shortcomings. Acknowledging and tackling this barrier is crucial for achieving therapeutic success and promoting equitable health care delivery. Our seventh section to be strategies for optimizing therapy outcome. To ensure that pharmacotherapy achieves its intended therapeutic goals, whether curing a disease, managing symptoms, or preventing complications, it is imperative to implement strategies and optimize the efficacy, safety, and adherence to medication regimens. These strategies must be multidisciplinary and rooted in evidence-based practices, personalized care, and system-level improvements. We have patient-centered approaches, enhancing medication adherence, empowering patients through education, shared decision making. We also have healthcare professional strategies, evidence-based prescribing, therapeutic drug monitoring, interprofessional collaboration. We also have implementation of, we have system and policy level intervention. Another is we have implementation of clinical guidelines and formularities, strengthening pharmacovigilance system, reducing the economic burdens of medicines, and also digital health and electronic prescribing. Technology improves pharmacotherapy through tools like electronic prescribing, clinical decision support system, and the medication tackling apps. This reduces prescription errors, alert prescribers to interactions, and help patients manage their medication more effectively. We have section 8, the role of pharmacists in pharmacotherapy. Pharmacists
again.
I don't understand.
It's not your work. You say you don't understand your work. So.
I probably repeated it.
No, you cannot. You have talked about this before.
Then section 9, case study. Finally, case study of optimizing anticoagulants in atrial fibrillation. Clinical scenario: a 68-year-old male with atrial fibrillation was prescribed warfarin for stroke prevention. However, the patient had subtherapeutic levels despite consistent dosing, putting him at risk for thromboembolism. Intervention: a clinical pharmacy conducted a medication review and identified frequent intake of vitamin K rich foods which interfered with warfarin's effectiveness. The pharmacist counseled the patient on dietary consistency and worked with the physician to adjust the warfarin dose. The patient was also enrolled in a therapeutic drug monitoring program. Outcome: within 2 weeks, INR levels stabilized within the therapeutic range. The patient avoided hospitalization and long-term stroke prevention was achieved. Pharmacotherapy principles illustrated. Okay. Therapeutic drug monitoring, patient counseling and education, interprofessional collaboration. That's what they use in achieving the outcome. Case study 2. Managing hypertension through community pharmacist intervention. Clinical scenario: a 55-year-old woman with uncontrolled hypertension was on free antihypertensive medication but was experiencing frequent headaches and dizziness. She often forgot to take her evening dose. Intervention: a community pharmacist implemented a medication adherence program using a blister pack system and provided lifestyle counseling, including the reducing salt intake and stress management. The pharmacist also communicated with the prescriber to simplify the regimen into once daily dosing using a combination pill. Outcome: over the next 2 months, her blood pressure reduced to 130/85, and she reported fewer side effects and better adherence. Pharmacotherapy principles illustrated: patient-centered care and adherence support, evidence-based medication simplification, health education, and chronic disease management. Summary for the case study. These case examples showcase how theoretical considerations and principles, when applied in the real-world settings, lead to successful pharmacotherapeutic outcomes. They also demonstrate the vital role of pharmacist collaboration and patient-centered strategies in clinical practices. Challenges and limitations in achieving optimal pharmacotherapy. Despite advances in pharmacological sciences and the development of therapeutic guidelines, numerous challenges still undermine the consistent delivery of effective pharmacotherapy. These barriers can be patient-related, healthcare system-related, drug-related, or even cultural in nature. If you have patient-related barriers, conclusion. General conclusion: pharmacotherapy play a pivotal role in management and treatment of various diseases, and understanding the theoretical consideration and principles that underpin its success is crucial for optimizing patient care. The evolving landscape of pharmacotherapy, shaped by advancement in personalized medicine, digital health, AI, biologics, and sustainability, provides a promising future for therapeutic intervention. The principles of pharmacotherapy are based on a deep understanding of disease mechanisms, drug action, patient characteristics, and the broader healthcare system. Effective pharmacotherapy requires a holistic approach that do not only considers the pharmacokinetics and pharmacodynamics of medication, but also integrates patient-specific factors such as genetic, lifestyles, and adherence. In conclusion, the principles and theoretical considerations of pharmacotherapy continue to evolve, influenced by technological innovation and a deeper understanding of human biology. As pharmacotherapy becomes more personalized and patient-centered, health care providers must remain adaptable to new developments and focus on optimizing therapeutic outcomes through evidence-based practice. The future of pharmacotherapy holds immense potential to improve global health and reduce the burden of disease, provided that challenges are met with innovative solutions and collaborative efforts across the healthcare sector. Thank you.
Are you done? All right, thank you very much. I want to make one or two comments. Your reference in this work is not is not how to reference. You were writing reference for introduction, reference for each of them. No. Your reference is your reference. Everything you are referencing should be one. There are nothing like referencing for introduction, referencing for this part. And I said you should use upper system, but I'm seeing the references are not alphabetically arranged, and you don't need these bullets you have there. In fact, this is not upper system you used. That referencing is not referencing at all. It's not upper system you used. I don't know whether it's a new system that came up. So please, I want you to, after this whole thing, still go back to that reference. I want to see a good referencing. And most of the work I enjoyed the work. Is relatable. I was just carried away. But 90% of this work came from pharmaceutical care by Professor Azoka. I think so, a Uniben professor. True of us. Is it true? But I did not see his name in your reference at all. His name did not appear in your reference. No, we are learning here. We are learning how to work. Tomorrow you become a researcher. You become researchers. You write textbooks. Yeah, so I must call a spade what? A spade. So that we can learn. We are all learning here. Nobody is trying to, but I was flowing, but the work, this is Professor. Majority of the work is from Professor. I've forgotten his surname, whether Azuka is his surname also. Textbook of Pharmaceutical Care. That's the name of the textbook. Textbook from Pharmaceutical Care. He's a professor in Uniben. So I know, I've read, I've looked at, this is his write-up, this is his system of writing, everything here, most of them came from him. But my issue is that I looked through here, I didn't see his name didn't even appear in your reference. And it's not a good thing. There's no in-text citation about him at all. There's no place of him in your work. No board, nothing. He didn't appear. If I am, let's assume I am the man and I come across this and I will sue you. You pay for the damages. It's called plagiarism. It's a serious offense in the academic world. At least you should, even if you say something about him, give his in-text citation about him in the reference. At least let his name appear there. That's my point, and I'm not happy about it. I'm not lying to you.
What if someone else copied from there? That's the name of the people that appeared, because I did not see his name at all.
Sorry, you don't even understand. We are going to that. Most of the thing I see. Sorry, I am speaking like this, but most of the things I see is his word. These are his words. It's not even this is exactly the way he put in his work.
Not rephrased.
That's what I'm making. So I need to point it out. This is an academic exercise. Hope you are together.
Yes.
This is an academic exercise. So I have to point it out so that even if you lose some marks here, mark on it. In your next work, tomorrow you see yourself writing for different journals, contributing articles to different journals, and this is where you learn it.
Okay.
Am I communicating?
Yes.
Yeah. I'm talking to you now because 10 years ago, call it 10 years ago, 10, 8, 7 years ago, I was like this. Professors sat down, Dr. Yoda sat down, and they were talking to me the way I'm talking to you now. So we pass it from one direction to another. So please, next time, don't make them. Don't try it. Get your materials. There's no issues. Get articles. Keep. Get your textbook if you want. If you want to. Even though I said I don't want. Even though I said I don't want. I don't want tertiary. Textbook is tertiary. I say I don't want tertiary. I want primary and what secondary. Well, anyway, I was just flowing with the work, but that work is tertiary. It's not primary. It's not secondary. That one alone is another issue. But that you might, what makes me uncomfortable is that he didn't appear here. Please, next time, get your materials, get everything, then look at it, synthesize your work from it, document your in-text citation, put it, then go to your listing, follow the recommended referencing system and the listing. But I'll commend that this work is relatable. It's not jargon. It's not too much of you come out here and start giving us wrong information. That one is even the worst of it. Information that you can't even do anything with. A very wrong information. The information you give is correct, but you just that you did not reference. I'm saying this so that in case Professor Azuka came across this tomorrow, he would understand that these are students learning how to walk. Am I communicating? Please, next time. All right, thank you very much. Let's clap for her, please. Thank you.
You clap, someone will clap for you.